Hello everyone, welcome to 2023 8th question. The fibers of the internal oblique muscle and transverse abdominis muscle contribute to which boundaries of the inguinal canal? Internal oblique muscle and transverse abdominis muscle together forms a arch and forms a conjoint tendon. This arching will form a roof. Okay, whereas this conjoint tendon forms a posterior wall. Hence, the option A is the answer. Let's see the diagram now. Inguinal canal. This is the deep ring, superficial ring. This is the inguinal canal. See, I have told you transverse abdominis muscle and internal oblique muscle forms a arching fibers and this forms a roof. Okay, and forms a conjoint tendon. You can see here arching fibers forms a roof, whereas conjoint tendon forms a posterior wall. Anterior wall is formed by external oblique aponeurosis and internal oblique muscle. Okay. Now, floor is formed by inguinal ligament. This is the inguinal ligament forms a floor, and there is a lacunar ligament also which forms a floor. Okay. Match the following muscles with their respective actions at the shoulder joint. Okay, actually, you have to remember this pectoralis major and latissimus dorsi almost have a same action, but except one action, that is, pectoralis major helps in flexion, whereas latissimus dorsi helps in extension. The similar action of pectoralis major and latissimus dorsi is adduction of the arm and medial rotation. Okay. Okay. Supraspinatus, it will help in abduction of the arm, whereas infraspinatus for the lateral rotation of arm. Let's see once. Pectoralis major helps in flexion of the arm, adduction, medial rotation. See, latissimus dorsi also same. Extension of the arm, adduction, medial rotation, same action. Whereas supraspinatus for abduction of shoulder joint from 0 to 15 degree, that is initial degrees, and infraspinatus for lateral rotation of the arm. Medial rotation by pectoralis major and latissimus dorsi, lateral rotation infraspinatus in this given question. Okay, so A is for A2, B abduction, B4, C is for lateral rotation, so C3, latissimus dorsi extension, so 1. So option is C. 10th one, the given below in the image 33-hour chick embryo, which of the following derived from the marked structure? Actually, we saw this image before. This is the notochord, whereas lateral to it is mesoderm. This is the paraaxial mesoderm. Okay, this paraaxial mesoderm forms a axial skeleton. Okay, this is in the center, right? So axial skeleton, which all comes in axial skeleton? Can you name 1, 2, 3? It is the ribs. Here the given option is ribs. Vertebra also comes in the center. Yes. Whereas kidney is formed by which one? We have learned this in our previous class. It is formed by intermediate mesoderm. Whereas pleura, everything is formed by lateral plate mesoderm. Dorsal root ganglions, all the ganglions are derived by neural crest cells. See, you can see here, mesoderm is divided into paraaxial, intermediate, lateral plate. Paraaxial gives somites, dermatomes, sclerotomes, myotomes. Myotomes means skeletal muscles and skeleton also, that is axial skeleton. Dermatomes gives dermis of back. Okay, whereas lateral plate mesoderm gives dermis of front and limb, and also it gives a appendicular skeleton, that is peripheral skeletons. Okay, and splanchnopleuric mesoderm gives cardiac muscle, majority of the smooth muscles. Okay, Intermediate mesoderm gives urogenital system, mesonephric duct, paramesonephric duct, and genital ridge. Okay. Coming to the 11th one, identify the structure marked A. Here, this is the A. This is the bronchiole, we can note that. But whether it is a terminal bronchiole or a respiratory bronchiole, see, you can see here also bronchiole. That means this is the respiratory bronchiole, whereas this is the terminal bronchiole. See, A is the terminal bronchiole, B is the respiratory bronchiole, C is the alveolar sac, whereas D is the alveolar duct. Very small one. 12th one, a patient's right hip drops when he takes a right foot off the ground. Which of the following would not be involved in the patient? Okay, they have asked which is not involved. So, we have discussed this question earlier also so many times. This is they have given a Trendelian verb test, isn't it? Let's see the diagram now. This is the normal person. Gluteus medius and minimus are normal. So when he lifts off right leg, the left leg is there to support him. Whereas when he takes off left leg from the ground, right side will support the body. But when right side is paralyzed, okay, when he takes off the right foot from the ground, the left side is normal, hence it will support the body. But left foot is off the ground, no one is there to support him because right side is paralyzed because of gluteus medius and minimus muscles, which is supplied by superior gluteal nerve. So three options we got now, isn't it? Superior gluteal nerve, yes, it supports gluteus medius and minimus also. Only which nerve is not involved? Sciatic nerve is not involved in lurching gait. 13th one, what is the role of marker structure in the given image? This is the thalamus, whereas this is the subthalamus. It is for the motor function. We have discussed about the basal ganglia, if you remember. This is the basal ganglia. Here you get a subthalamic nucleus. It is for start and stop of the movements. So it is involved purely in motor activity. If you want a detailed explanation, I have given in my previous videos on the basal ganglia question. You can see there. Okay, this is the motor function. Coming to the 14th one, which of the following vessel is involved in the condition affecting the region marked in red? This is the medulla, and this one single nerve going in the center is the hypoglossal nerve, that is 12th nerve, whereas this one is the lateral side and lateral medullary syndrome. Okay, lateral medullary syndrome, which artery? That is the posterior inferior cerebral artery. Okay, PICA. Okay, let's see the explanation here. First thing you have to know which all nerve comes where. If it is a midbrain lesion, there will be 3 and 4. You get a Weber syndrome. Okay, let me explain here only. That is, patient presenting with contralateral hemiplegia with ipsilateral ptosis. Okay, this is by the posterior cerebral artery. This is the midbrain syndrome, that is Weber syndrome. Whereas Pons, you can get a lateral pontine syndrome, isn't it? Or which all nuclei present in Pons? 5, 6, 7, 8. In medulla, 9, 10, 11, 12. See the medulla lesions now. This is the dorsal side, this is the ventral side. This is the 12th nerve nuclei, that is the hypoglossal nerve. This is the olive, Whereas here you can see the different nuclei. If there is a medulla lesions, if it is medial side, then medial medullary syndrome. If it is lateral side, lateral medullary syndrome. If medial medullary syndrome, the most common nerve gets injured is, that is 12th nerve, medial side, isn't it? So 12th nerve. If 12th nerve comes in the question, that means medial medullary syndrome. Okay. Here the patient has a tongue palsy, that is ipsilateral tongue deviation will be there, contralateral hemiplegia, and contralateral loss of conscious proprioception. Which artery? The vertebral artery or anterior spinal artery is involved. Whereas the lateral lesion, that is lateral side of the medulla, is involved. This is called as Wallenberg syndrome. The main complaints will be nystagmus, vertigo. This is when vestibular nuclei is involved. Whereas when spinothalamic nuclei is involved, contralateral loss of pain and temperature will be there. Spinal trigeminal nucleus is involved, then there will be ipsilateral loss of pain and temperature of the face will be there. Descending sympathetic tract, ipsilateral Horner's syndrome, where there is meiosis, ptosis, and anhydrosis. When nucleus ambiguous is involved, that is 9 and 10th now, there will be dysphagia, hoarseness of voice. You can remember this by Pikachu. In our patient also, same thing you can remember. Pikachu means, Pika means same, posterior inferior cerebral artery. Chu means can't chew, that is dysphagia. When Pikachu comes in the question, that means the most common artery involved is vertebral artery, but it's not given in the option. So posterior inferior cerebral artery is the answer. Whereas sometimes they can give lateral Fontaine syndrome, that is the facial nuclei is involved. The ipsilateral facial nerve palsy will be there, and loss of corneal reflex and cochlear nerve, if it is involved, deafness will be there. This you have to remember. 7 and 8 nuclei, 7 and 8 nuclei. Okay, and everything is same like a medulla only. And here you can remember when facial comes, that is ipsilateral facial nerve palsy, that is lower motor neuron lesion. You can remember facial, whereas ACIA, you can write it ulta, you will get the anterior inferior cerebral artery. Okay. Here, see, this thing is little bit confusing, but you have to remember the pons has a nucleus for facial nerve, isn't it? So before the facial nuclei, if there is a lesion, that is supranuclear lesion, that will lead to upper motor neuron lesion. Hence, in Weber syndrome, the facial nerve palsy will be there, but it's a upper motor neuron. Whereas in lateral Fontaine syndrome, the facial nerve is involved in the pons, isn't it? Like in the pons or below the pons, will lead to lower motor neuron lesion. Hence, there will be ipsilateral side facial paralysis. Okay. If you have any doubt, please comment. I'll teach in the separate section again. Because that is very important question even in medicine also. So here answer is Pika. Identify the arrow marked structure. This is the aorta, but they have marked this one. What is this? Pulmonary trunk. Okay, option C. You can see other structures here. See, this is taken at the section T5. So you can see pulmonary trunk there, bifurcation. This is the thoracic wall. This is the cavity, pleural cavity. This is bifurcation of the pulmonary trunk. This is the ascending aorta. This is the descending aorta. Okay. This is the esophagus, and this is the left principal bronchus. Okay. This small vein is the azygous vein that is near the aorta. Okay.